Welcome to part 2 of Introduction to Experiments. In this part, we will consider the three basic experimental designs. Those three designs are the completely randomized design, the randomized block design, and the matched pairs design. In the completely randomized design, we have a number of experimental units, subjects perhaps, people, and they would be assigned to the various treatment groups in a completely random manner. The randomized block design is slightly different. In this case, the experimental units, or subjects if we have people, are first divided into smaller groups. These groups are called blocks. Then within each block, the subjects would be distributed between the various treatment groups. When we use a randomized block design, the idea is that the blocks represent some kind of a characteristic among our experimental units which may be important to the outcome of the study. Finally, in a matched pairs design, units are paired for comparison. Now this could possibly be something like two people that are very similar, such as identical twins. It also includes the possibility that the pairs are actually the same subject but in before and after measurements. We'll be looking at some examples of each kind of design so that the differences will be made clear. Suppose we wanted to answer this question: which kind of running shoe reduces injuries? Our goal might be to compare the rate of foot and joint injuries that are experienced by using 5 different brands of running shoes. Well, an experiment could be designed in the following way. Suppose we had 40 competitive college runners who were our subjects and 5 brand name shoe suppliers. The runners would be assigned to one of the 5 groups, say by the roll of a die. Each group would receive a different brand of shoe, and the number and type of injury that is sustained within the group would be recorded and then compared between the groups. Let's take a look at how this experiment implements control, randomization, and replication. It's perhaps easiest to do that by thinking of this diagram. First of all, we start with all of our runners. Then, in a random manner, divide them into 5 different groups with 8 runners in each group. Then again, at random, assign a brand of shoe to each one of these groups. We keep records over the running season, and then at the end of the season we compare the relative rates of injuries that occur between these groups of runners. As far as control goes, this is implemented. We are comparing between groups. We are not simply assigning a single brand of shoe to see what the results are, but rather we're comparing the differences between the shoes. Then, if we had, for instance, a season that was particularly hard and therefore more likely to produce injuries, this difference compared to normal seasons would be experienced by every single group, and that variable would be controlled for. Likewise, it could be that weather conditions made injuries more likely. Again, this would be controlled for because every group, using every brand of shoe, would experience the same conditions, and therefore we would have controlled for the variable of weather. Comparison, then, is what gives us control in this experiment. Secondly, randomization. Randomization is implemented, first of all, because the composition of the groups is constructed at random. Whether a particular runner goes in group 1, 2, 3, 4, or 5 is a decision that's made at random. It's not the decision of the person who is administering the experiment. And finally, which group gets which brand of shoe would also be assigned at random. Therefore, randomization is implemented in this experiment. Finally, replication. Replication is implemented in this experiment because each of the treatment groups has 8 different runners. It is, of course, possible that one particular runner may be prone to injury, or another runner may be particularly resistant. But what we expect is those runners who are especially resistant to injuries are more or less evenly distributed among the groups. And in the same way, those who are prone to injury are also more or less evenly distributed among the groups. Therefore, we can conclude that any major differences between the groups is probably caused by the only difference between them, namely the brand of shoe that they are using. Now, it is a possibility that male and female runners have different needs in terms of their shoes. Whether this is the case for running shoes actually is probably open to debate, but it wouldn't be hard to imagine an experiment we would expect that male and female subjects would be quite different. If a group happened to get mostly men or women, injury rate could be affected if males and females are different in their shoe needs. However, we could reduce the influence of any gender difference by considering men and women differently by separating them into blocks. We're going to describe then a block design for this experiment. What we could do is first of all take our subjects and divide them into two blocks, the male and the female runners. Let's suppose, for the sake of convenience, that we have 20 male and 20 female runners available. Then, of the 20 men, we could divide them randomly into 5 groups of 4 runners each. Each of the 5 groups would again be randomly assigned a particular brand of shoe, and then the rate of injuries for the season could be compared between these groups. Likewise, the women would be randomly assigned among 5 groups. They would be randomly assigned a brand of shoe, and then we would compare the differences between the men and the women. The advantage of this kind of design is the following. Suppose that brand 3 shoe were to work better for the men, and brand 5 shoe were to work better for the women. This block design could actually detect that difference. In the case of the completely randomized design, we might only notice that injuries were relatively low for both brand 3 and brand 5. We wouldn't necessarily detect the fact that one brand is better for men and the other brand is better for women. It gives us examples of both completely randomized designs and the randomized block design. Let's move on then to matched pairs. Sometimes the most important differences that we see in experiments are not linked to the various groups, but rather to the individuals. When individual variation is so large that it overwhelms the treatment effects, we consider the matched pairs design. Matched pairs designs are used to improve sensitivity to the treatment effect and to reduce the variability due to individual differences. A number of nature versus nurture experiments have been conducted using the matched pairs design. For instance, identical twins who were separated at birth make ideal subjects for this kind of study. A genetic predisposition for schizophrenia has been investigated in this way. It has been shown that among twins who are identical, if one develops schizophrenia, it is more likely that the other will as well. We can also measure the effects of certain kind of drugs well in this way. Suppose, for instance, we wanted to measure the effect of a certain drug on blood pressure. A natural way of doing this would be to check a patient's blood pressure, then administer the drug, and check it again. This is also considered a matched pairs design. Finally, suppose we had different brands of golf balls and we wanted to compare the distance that they can be driven by a golfer. Let's look at that one in detail. In the case of the distance of a drive, the skill and strength of the golfer dominates. Whenever individual differences dominate, you should consider a matched pairs design. Suppose then we had 7 golfers and 2 brands of golf balls to work with. Each golfer might be given, say, 12 balls of each brand, so that they have a total of 24 balls. Then the golfer's average distance for each brand would be computed. Let's call those numbers distance A and distance B. Then, for each golfer, we could compute the difference between the distance they hit brand A balls, on average, from the distance they hit the brand B balls. These differences are what we would look at in our study. A diagram of a matched pairs design looks in general like this. We have units or subjects who are first of all divided up according to pairs. In the case of a before and after matched pairs design, the pair represents really a single subject, and it's a pair of experiences that that subject has. Then there is a random assignment of treatment 1 or treatment 2 to the members of the pair. Now, this can be done even with the before and after style. Suppose we wanted to measure the effects of a certain drug on blood pressure. What we could do is measure the patient's blood pressure before they've taken the drug, and then again after. On the other hand, with other patients, we could measure their blood pressure after administering the drug, then wait until the effect is worn off, and take the pressure without the drug later. This makes random assignment possible and would help to eliminate the differences, say, that occur from earlier to later in the day. We then compare results within the pair. Finally, it's these comparisons which are compiled overall to give us the data from the experiment. Here's another matched pairs experiment. Do low rolling resistance tires improve fuel economy? Now, individual variation between drivers and vehicles is so large that it would certainly overwhelm the small difference between standard and low rolling resistance tires when we're looking at fuel economy. So a matched pairs design is certainly the design of choice to address this question. Let's suppose we had 10 cars and drivers that range from, say, hybrid subcompacts to SUVs. We might proceed with these resources available would be the following. Each vehicle could be fitted with new tires. Now, some of the vehicles should get standard tires, and some of the vehicles should get low resistance tires for the first round of the experiment. Then the fuel economy could be recorded for, say, 3,000 miles of daily driving. Then, once again, each vehicle would be refitted with the opposite kind of tire they had for the first round of the experiment, and we would record fuel economy again. Finally, we could look at, say, the percent improvement of the low resistance tires compared to the standard tires on a particular vehicle. These percent improvement figures are what we would look at as the data that come from the experiment. Finally, let's consider the possibility of placebo effects. When we're working with people rather than with inanimate objects, there are psychological effects that can influence the outcome of our experiment. For instance, people will sometimes experience an effect that is not due to the treatment, but rather to their own expectation of the effects of the treatment. This is called the placebo effect. For instance, if patients in pain are administered a sugar tablet, they may experience a decrease in that pain if they think the tablet contains an analgesic. Placebo effects can also be induced by the researcher or the person administering the experiment. These expectation effects have been documented in medicine. Treatments that physicians think will help are more likely to succeed, even if they cannot be shown to be more effective in controlled testing. Blinded experiments are the way we try to control for placebo effect. In a single-blind experiment, the subjects do not know whether they are receiving a placebo or the treatment that is under study. Of course, this cannot control for a placebo effect that is induced by the expectation of the administrator. Therefore, a double-blind experiment is considered better. In these, neither the subjects nor those administering the treatments know who receives the placebo and who receives treatment under study. A good example of the double-blind experiment is the testing of the gastric freezing procedure that was developed and then later discarded in the 1960s in the United States. In this treatment, people who were suffering from ulcers were treated by what was called gastric freezing. Gastric freezing meant that freezing liquids were pumped into the stomach of the person with the ulcer to relieve pain and enhance healing. Patients did report significant improvements, and in fact, the Journal of the American Medical Association reported in an article in 1962 that the stomachs of 80 patients with duodenal ulcer have been frozen with immediate relief of symptoms, early disappearance of ulcer craters, and depressed gastric secretory responses. This study, by the way, was an observational study rather than a controlled experiment. A few years later, other researchers decided to see whether the results would hold up under a more formal study. A double-blind controlled experiment was reported then in 1969 in the same journal with new results. Patients were assigned randomly to treatment or to placebo groups. Now, some of the machines were subtly modified so that even though the tubes that went into the patient's mouth and down into the stomach did grow cold, and they could hear the pump run, but the liquid contacting the tissues in these patients was not chilled. So neither patients nor attending physicians knew whether the treatment that a particular patient was receiving was the placebo or the usual gastric freezing treatment. Now, improvements were still reported among patients, but patients in the treatment and control groups experienced approximately the same level of relief. The study concluded that gastric freezing's benefits was a result of the placebo effect alone, and the treatment was therefore abandoned. Well, that ends our lesson on an introduction to experimental design. At this point, you should know the difference between controlled experiments and observational studies, namely that experiments impose conditions so that we can observe the results, while with observational studies, we merely observe what is already there. Why do we use experiments? Because only experiments can imply a cause and effect relationship. The three basic principles of experimental design are control, randomization, and replication. You should be able to identify experimental units, response variables, factors, levels, and treatments. And recall and identify that the three basic designs are the completely randomized design, the randomized block design, and a matched pairs design. Finally, the placebo effect is the effect that is due to the expectations of the subject or the researcher. It is controlled by using single or double-blind experimental designs. Thank you for watching this video, and that ends our lesson on an introduction to experimental design.